So we have an overflow crowd tonight, and that's amazing in spite of COVID. And so tonight we're going to learn, and we want to study, what does it really take to be healthy? What does it take to be successful in becoming healthy? So I'm just going to throw this out to you. If you guys want to make a comment on that or answer that question, you can if you want to. But what does it take? I mean, if you're going to go from being a non-healthy person to being a healthy person, what is that going to take?
Take a lifestyle change.
Yeah, okay. A lifestyle change for how long?
The rest of your life.
Yeah, for a long time, okay? So anytime that you want to be successful in anything, those laws are applicable to no matter what you want to do. And they're certainly applicable to health. So there's nothing in life of virtue, of quality, of growth, of hopefulness that can be accomplished without the humility of what we call time, frequency, intensity. So just think about it for a minute. Let's say that you have a son, a nephew, a husband, or yourself that wants to be an incredible athlete. One of those kinds of athletes that people pay a lot of money to go see. Okay? Do you think those athletes go to college and say, well, I'm going to take a crack at it for 3 months and just see how it goes? No. They train for years. So what about frequency? Do they say, okay, I'm going to go to a class, I'll try it for twice a week, pay, take a couple classes, try it twice a week, pay by the visit, 3 or 4 or 5, 6 weeks, see how it goes? No. They're training all the time. What about intensity? Do they stay on the team if they play half-heartedly? What about if they say, well, I'll do the weight loss drills, but I won't do the speed drills, or I'll do the reflexes, but I won't do the weight training. And a coach is saying, look, buddy, either you're in or you're out, okay? And the coaches are constantly testing those athletes to see who's going to make the team and who's not going to make the team. So, I'm not here to drive people that hard, but think about it. Doesn't some of that time, frequency, and intensity, if we're going to take anything to greatness, doesn't our health deserve some of that? I mean, certainly the health of our bodies, our ability to have healthy aging parents and aging grandparents, doesn't that deserve some of that? What about performing arts? Would you go see somebody skate who hadn't practiced over and over and over, and all they did was fall? I mean, no, you wouldn't want to see that. You wouldn't pay to see that. What about, would you send your kid to a college where the professors never really studied, never really pursued the scholarly pursuits to enlighten the minds of the kids? No, you wouldn't send your kids to a place like that. Well, so as doctors of chiropractic, and this is something that I want people to really understand, is we stuck to the principles of changing and choosing chiropractic, not to understand necessarily all the intricacies of how disease ravages our bodies, but we want to understand health. How do you achieve health? How do you make your body a body that doesn't incubate disease nearly as easily? And don't you think that is a pretty relevant topic now in this age of COVID? How do you make your body healthy enough so it doesn't tend to incubate COVID? Or if it does, you don't get it nearly as bad. See, that's what we're really all about in chiropractic. We want to understand what makes people healthy. So, what if someone crashes and burns, doesn't take care of their health? So let's take a heart attack, for example. what happens when people have heart attacks? What after they're in the hospital, they're revived? What's a cardiologist usually do? Says you got 3 months of cardiac rehab. They don't even ask. And I have patients like that. They don't ask them, would you like to do cardiac rehab? They sign them up for it, and they're going to be 3 months. They don't ask them, listen, would you like to pay by the visit and maybe see if you want to do this or quit after 2 or 3 weeks? They don't even think about that. They sign them up and they expect them to do it, and they do 3 times a week of cardiac rehab. So what about if you wanted to lose 100 pounds or 200 pounds? That would take several years of work. Okay, you wouldn't do that in a week or 2 weeks. It takes years of persistence to do that. So when are people going to stop working? People that want to lose weight and keep it off, when do they stop working on their fitness? Never. They don't. Okay? People that are working on the fitness of their heart, when do they stop? They don't. Okay? When does an athlete stop working on the sport he loves? They don't. Okay, look at Tom Brady. I mean, he's 43. He's still playing quarterback. He's never stopped working on it. Okay? So anything that's virtuous, we never stop working on. Never. So why would we do it? Why would we do that with our health? In my practice, here at Lincoln Disc Nutrition, discipline equals freedom. When we learn the disciplines of taking care of our spine, we're going to be able to use it in ways that we haven't been able to use it before. Okay, have you ever known people that you think, you know, you're too young not to be able to walk up and down stairs properly. So they can't use their bodies the way they're supposed to be able to, or they can't bend over and pick something up. Okay, so with or without me, eventually you're going to learn how to sleep properly. Without me, you're going to have to learn to sit properly. With or without me, you're going to have to learn to lift properly. With or without me, you're going to have to learn that postural distortions makes bones sick. So here's an example of the different postural distortions. And these are the ones that I really pay attention to. Now, some of these are problems that they've developed over time that are cemented into their spine that you really can't change very well. But this is one right here. I work really, really hard on changing this one and this one. I have some patients like this that have a deformity in their lower back that you're not going to change. But the fact of the matter is once you learn to take care of your spine, how long are you going to need to do it? I mean, I've got the answer for the rest of your life, okay? So why would you have to take care of your spine for the rest of your life?
Well, you need it until you die.
You've only got one. There's no such thing as a spine transplant. I mean, we're probably 200 years away from that. Okay, you get your teeth transplanted. You can get, you can get false teeth. You can get, teeth screwed up in there, which, by the way, doesn't always work very well because I have patients come in and tell me that. And you can get a lung transplant, a liver transplant, a heart transplant. But there's no spine transplant. And this is why I tell people you need to learn to take care of your back for the rest of your life because you only have one. Okay, and if you want to be able to lift groceries out of your car when you get to be in your 60s, you got to take care of yourself so you're able to do that. So time, frequency, and intensity are important in this practice and in any other center of true health care. That's why I put my patients on a schedule. That's why you need 3 months, 6 months, sometimes even a year to get well, depending on how bad you were when you first came in. If I play small in giving people a big picture in health, they get limited quantities of recovery. So this evening, this afternoon, I met with a patient, and I looked her in the eye, and I said, you're going to need to see me for a year. You are so bad right now. You are so debilitated from all the things that have been done to you, meaning her medical care, that I can't get you well unless you're willing to stick with me for a year, because I've had experience with patients just like her. Some people need a year of care. That's what they're going to need. Some people, I look at their spine, it's pretty good. I say, well, we could probably get you well in 3 months, and then we'll see where you want to go from there. Okay? Some people need a little bit longer than that. Okay? But depending on where you're at when you come in, some people that come into me are basically ruined wrecks. And it's going to take time to fix those people. Some people are a little better off than others. So joints need to be moved as close to 100% of their range of motion as possible. The more they glide in a healthy manner, the healthier they are, the more they'll stay vibrant. Would everybody agree with that? That you have a joint, that joints are supposed to glide, and if they're not gliding, I mean, your tires are supposed to roll. If they're not rolling right, if they're grinding, that's not a good thing. Anybody in here ever have their transmission grind other than me? Okay? It's not a good thing, okay? You can't take that in and pick your car up in 20 minutes. You know, it's going to take a while. Well, the same thing with your spine. The more your joints glide in a healthy manner, the more they're going to stay vibrant, and the less strained and inflamed they're going to be, and the less pressure they're going to put on nerves, okay? So ligaments were made to be stretched. What do ligaments do, by the way? Anybody?
They tell your body where the bones are in relation to each other?
Yeah. They hold bones together, for one thing. Okay, so ligaments hold bones together. They're very well innervated, and they tell where your body is in space and time. So the fact that I can do this, okay, it's ligaments feeding into my brain that tell my brain that my arm is over my head. So ligaments were made to be stretched. Okay, how do you stretch ligaments? Anybody? You exercise. Okay, that's how you. Ligaments were made to be stretched. Okay, and they need to be compressed and distracted. So how do you compress and distract ligaments? Depending on what ligaments you're trying to, But how about like just some simple weightlifting? How about doing some push-ups? How about just regular exercise? I can't do that, by the way. Okay, I don't think I've ever been able to do that.
No.
All right. So muscles need to be contracted and relaxed, and muscles need exhaustion. They need to be exhausted. So how do you do that? Primarily exercise. Your gait works better, your coordination works better, the more that you use it, okay? So what do I mean by that? So your gait, the more you walk, the more you use, the more you walk, the more you exercise, the more you have to use coordination, the better it gets. So what are some coordination exercises we could do that might help us? Anybody?
Ride a bicycle.
Okay. That's not a bad one, okay? There's ones that are a little bit more specific, okay? So how about just standing on one leg and seeing how long you can do that? That's a great coordination exercise. And close your eyes. See how that goes, okay? So that's a really good coordination exercise. Anybody think of another one? How about walking backwards? Okay. So one of the coordination exercises I do, you don't have to do this one, I'm not telling you have to, is I run up hills backwards. Because it forces my body to use muscles in a way that, and it forces my body to use a brain in a way that we can't use it any other way. So in my neighborhood, I'm called the dude that runs up the hill backwards, because I'm the only one who does it. Okay, so the more you use your coordination, the better you're going to be coordinated. Why is this important? Why is it important, coordination important?
So you don't fall?
Yes. As we get older, one of the best things you can do as you get older is not fall. So if your coordination, if your brain is teaching you, you're just telling your body where it is in space and time, the chances of falling are way less, okay? So any type of coordination exercise you can do is really helpful. So getting adjusted really helps with this, but so is doing the homework that I give people, okay? So as we're going to find out later on next year, I'm going to do a talk on this, how getting adjustments causes your brain to coordinate your body better. That's an entire talk I'm going to do. So discs, they need to be compressed. Tendons need to be utilized. What do tendons do, by the way? What's the job of a tendon?
They just connect your muscles to your bones. Right?
That's exactly right, yeah. And they also help your body tell your brain where it is in space and time. It's called the muscle stretch reflex. So time, frequency, and intensity are really, really important in getting well. That means that when you miss appointments, that brings your that pulls you back in your care. So think about it like this: if you're, let's say you want to get in shape. So it's January 1st. You're absolutely intent on getting in shape. So you're going to go to the gym 3 times a week. Would that, you think that would be a reasonable schedule to get in shape 3 times a week? Yeah, it would be. That's pretty good, actually. So what if you decide after 3 weeks, I think I'm just going to go once a week? So what do you think is going to happen? Do you think that you're going to get in shape nearly as quickly?
No.
Absolutely not. No, you're not. Okay? Well, that's just like appointments. When you miss appointments in my office, it's like not going to the gym. That's why appointments need to be rescheduled, and we don't have missed appointments. So you go to the university, you miss too many classes, you fail. Okay? Here, failure is a broken physiology, a sick spine, and a body that ultimately deteriorates. That's what failure is in my office. And we're going to talk about why people allow that to happen here in just a minute. The problem is the body's so resilient that you can abuse it for decades before it starts talking to you. So, you know, that car accident that you got in when you were, 18, when you're in your 30s, you might find that one of your arms starts going numb. That may be from that car accident that you were in when you were a teenager. And the problem is this, is that with people, once the pain goes away, what do you think a lot of people start doing? They get back into the old habits they had, to get the pain in the first place. So when arthritis develops, that's not when healthcare begins, that's when crisis care begins. Arthritis takes about 30 years of abuse before it shows up on an x-ray. So there's a normal disc right there. There's an arthritic disc. Thin disc, bone spurs. That's 30 years of abuse of the spine right there. So that's really not health care. That's really crisis care. And if you can start caring for your joints when you're young, your body's going to work a lot better when you're old. So whoever you are, if you have joints, your joints need some attention to time, frequency, and intensity. And I don't care what you do, what kind of exercise you do, they need some exercise. And your spine needs to be adjusted if it's not going to deteriorate. So when are you done caring for your spine? As far as I'm concerned, never. If your spine were on your face, would you take better care of it? Most people would, okay? So when most people come to see me, there's a lot of work at first. And after that, I discharge you from initial recommendations, and you can decide how much work you want to put in to taking care of yourself. Now, some people will come that need to see me once a week for a long time. Some people, after they're done, will pop in once a month to see me. And I have people on both of those spectrums, okay? But the fact is when are we done, like, brushing our teeth?
Remember?
Why? Why are we not done brushing our teeth?
We want to keep our teeth in.
Want to keep them. Okay, when are we done loving our family?
Never.
Do we stop at 50? Well, I'm done. You know, I don't want to love my kids anymore. No, we're never done. So we're never done taking care of our spine. Your brain and your spinal cord control everything. Don't you think it makes sense to take care of it? So time, frequency, and intensity are the things that you cannot subvert. Anybody you know who this is? It's an Olympian, Bill O'Brien. He was a decathlete, or he was a, yeah, he did the decathlon, and you know he got adjusted regularly. And why did he do that? He didn't get adjusted because he had migraine headaches or because he was having sciatic pain. He got adjusted because he performed better. His body worked better. So whether you're a musician, a designer of nuclear subs, doesn't matter what you do, a chiropractor, adjusting the spinal column, time, frequency, and intensity is important. If you're learning to play the guitar, you can't do that practicing once a week. You have to practice every day. I know because I took lessons for a long time. So chiropractic is pure, clean, and simple. You show up for your appointments, ask questions, learn quantities of information. And, you know, when you come to these talks and learn how your body works, and then you get adjusted, and you put those two together, that's really when miracles can happen. I mean, how many of you known people that have had cancer that were told they have, you know, 6 months to live, 3 months to live, and 5, 6 years later they're still out there chugging along? We've all, I mean, we're not statistics, and as long as we have some breath in our lungs, we have the potential for miracles. But we have to do the right things to create a healthy body. So that's all I have for tonight. Does anybody have any questions about anything I've gone over? I've actually ended a little early. Okay, good. So thank you so much for coming tonight, and if you have any questions in the future, I'd be happy to answer them. And just remember, anything you do in life, but especially for your health, are going to require the issues of time, the issues of frequency, and the issues of intensity in working on those things that you want to be better in your life. So thank you very much.